Good morning. My name is Dr. Karen May, and today's Empower Hour, and we have some great questions that have come out of this group that I want to take an opportunity to answer. And so, first and foremost, this is for educational purposes only. Each and every one of your journeys and conditions is completely individualized, and so use this information, find an action step, but also consult with your doctor. So, thank you again for joining us today. The questions that were coming out of this group were, I'm burning and aching at night. Why? And I only have balance issues. Why? And I have all of it, and it's terrible. Why? And so I wanted to give you the why behind it, because if you know what's going on in your body, you can either have a great educated conversation with your doctor. But also then there's things that you can do specifically around your condition too. So let's jump in. So we have different types of nerve fibers in our body, and they do different things. So we have large nerve fibers and we have small nerve fibers. And the three main functions are motor, so making muscles work, movement, then there's sensory, so it is all of the hot, cold, burning, everything like touch, vibration, all of that. And then there is called autonomic. So that's what tells your heart to beat, your lungs to breathe, your belly to digest, all of those different functions so those are three different functions of a nerve. With neuropathy, some of those functions can be gone. All of those functions can be affected, and it's hard to determine at what level they are affected at times. And many times when your doctors are looking at you, they are just looking at the symptom you're having and not looking at you as a whole person. So keep that in mind too. They're looking at a particular organ, or they're looking at just your feet or your hands. They're not coordinating everything together because that's just the way they're trained. So let's talk about nerve fiber anatomy now. I'm going to keep this really super simple so that way you can understand what's going on in your body. The difference between large and small nerve fiber is just that. When you look at the diameter, if you were to cut a nerve and look at it, it means that the fibers in what's called the axon, I like to think about like copper wires, means they're big. And they are covered with a thick, fatty, cholesterol-made coating called myelin. So the copper wires that are thick, are bigger, and those are, and then the covering on top is myelin. So we have axon, which are the fibers, and then myelin, which is the thick, fatty coating. Those are balance and vibration and touch, even some light touch, and then also joint position sense. So if you're walking around your home and feeling like you got to grab onto something, or you get up in the middle of the night and it's dark and you can't see, your feet are not sending the right information up to your brain for you to know where you're at in space. So you got to grab onto something, or you feel unsteady. Or you're in your shower, you close your eyes to wash your hair and you feel like you're going to fall. Those are large nerve fibers. Now, small nerve fibers are a little bit more complex. So they have the myelinated, meaning they have a light coating around them, not a thick fatty one, but they have a light coating that's made of cholesterol around them. And some of them don't have coatings at all. And the small nerve fibers are literally small. So if you cut it in half and you're looking at the diameter of it, it means all the little fibers are tiny in there instead of thicker and bigger like the large nerve fibers. So, and again, their regulation is more temperature or called thermoregulation. So that hot, that cold, and it's also pain. So a lot of pain fibers are in that as well. And then those small nerve fibers also are what send a lot of the information to our organs. So a lot of the autonomic, or what tell our heart to beat, our lungs to breathe, belly to digest, all of that good stuff. A lot of those are small nerve fibers. So again, some are covered lightly with that myelin and some are not. And so they just look like a copper wire. So I'm going to really, really try to dive into the small fiber neuropathy because, right now, because that one is the burning, the aching, and I want to cover what that looks like. Small fiber neuropathy is usually gradual in onset. It's not something that happens immediately. So it starts with that you got like a wrinkled sock feeling, or when you're touching something with your hands, you can't button your buttons as well. It feels like you got almost like a layer between your skin and whatever you're trying to touch. Maybe like in your feet, you feel like you're consistently stepping on a pebble, but there's nothing there. So that's the kind of the first warning lights that are going on. Then you can start to get that cold-like pain, and where sometimes you feel cold, but if your spouse or a friend or someone were to touch your hands or your feet, it feels normal. It's not cold at all. And then that's where the pins and the needles and the tingling start to come in as well. As we progress up, as the nerve function starts to die, we start to get misfires. So those misfires become more severe. Where your brain and your body are trying to coordinate to understand what is going on within that sensory function. And so that's where the burning will occur. That's where the electric shocks that will happen for just a brief moment, but they're super intense. And then they get to be more frequent. That's where you can also be hypersensitive, where you step on something small and it sends you through the roof, where someone else could do it and they're like, it really wasn't that bad. And so this is also where you may not like socks, and you can't stand your shoes on. You're always searching to find the next best shoe because no shoes are comfortable. And maybe you don't like the sheets or the blankets or covers touching your feet because it just sends you bananas. So that's the small nerve fiber. So that pain, and that's where those small nerve fibers, it is notorious that they seem okay when you get up in the morning, and as the day progresses, they start to get worse. And then by the time you sit down at night or go to lay down, your feet are burning and they're just on fire, and you're just consistently moving them. And so those are the small nerve fibers that are occurring, that are being damaged. So again, so let me talk about the autonomic piece of the small nerve fibers. So that can be lightheadedness, that can be abnormal, like gastrointestinal function, where you're just not digesting, or you could have constipation, diarrhea, erectile dysfunction. But this is also circulation, because those small nerve fibers on the autonomic side help to regulate the blood vessels. So you could abnormally sweat. Maybe you don't sweat at all. Maybe your feet look red and shiny. They look like fat little sausages that are about to explode. It maybe look purplish and not have a good blood flow. So those small nerve fibers also help to regulate out blood flow. And so circulation is important as well. If we cannot get good circulation to those nerves, we can't even think about healing and repairing them. So again, just kind of wrapping again, we have large and small nerve fibers. What they do is they control motor, so muscle. So they also control sensory. So it's all of the symptoms you're feeling with the pain, temperature issues. And then they also control some organ function and internal cell function. So those are the three main categories. So you literally can have one type of neuropathy. You could just have large nerve fiber. So all you have is balance issues. You don't have any of the pain. And for those of you who have both, you can, and it's terrible. So So looking at this, and you can have just small. So maybe you're only getting started with this and you only have the pain at night, and you have no balance issues. So usually small fiber can progress into large fiber over time the longer that you have it. And the autonomic can be happening and you not even realize it's going on because, again, you're not thinking, because it's not burning and pain on the inside. It's just its organs not functioning well. So now we look at how doctors typically diagnose it. And there's lots of different ways out there, but I'm going to talk about the common ones that most of you have either tried or doctors have sent you to neurologists for. One's called an EMG or an NCV, so electromyogram, or a nerve conduction velocity test. And that's where they either put patches on different parts of your body, or they stick needles in and they send a signal between. So they're trying to see how your body is, can the signal get there? Does it transmit, evenly and quickly like it's supposed to? The problem is if you have small fiber neuropathy, that's going to come back as normal because that's only really checking large fiber neuropathy. And again, great diagnostic tool, but it only shows one type. Small fiber neuropathy is much more difficult to diagnose because many times it takes such a long period of time before we're seeing a difference in hot and cold. Like you can perceive it. We're between like a pinprick. It just is a slow progression. So what they will sometimes do, and not very, very commonly, is they'll do what's called a punch biopsy. They'll do a skin biopsy, and what they're doing is they're looking for the number of small nerve fibers in a small little area of skin that they've taken. So when it comes down to it, there's over 100 different causes of neuropathy. So doctors have probably recommended B vitamins because that can be one of them. Maybe they've control your blood sugar. Maybe you've had chemo that damaged it. There's literally there's over 100 different causes. So sometimes you can get down to the root cause and take care of it. Sometimes it's a conglomeration of a bunch of stuff going on, and here you are. It could be trauma because of what you've done in your job. Because don't forget, all of these nerves start in your spinal area. They come down from your brain through your spinal cord and out. And so if there could be damage in there, literally 80% of people who have some sort of spinal condition has some form of neuropathy. Maybe you've had injuries, maybe you've had surgeries, maybe you've had medications that's caused your neuropathy. Literally, there's 100 different causes of it. So coming back to it is, what can you do? Because that's really what it comes down to. Can you heal and repair fibers? In this group, I'm going to be completely frank and honest. It's disheartening at times because there is so much misinformation, but people are desperate and hopeless and fearful, and they think that they've tried everything, and so when they get on there, they are just craving information but unwilling to necessarily change something to do it. So please understand that what you have done so far has gotten you to where you are at. Maybe you've gotten some results, maybe you're not getting any better, maybe it's staying the same. But the definition of insanity is doing the same thing over and over and expecting a different result. So when I see comments on there from multiple people over and over and over again, my question to you, and my team puts this in there a lot, is what have you done? What have you done to change where you're at? Because if nothing changes, then nothing changes. So when we're looking at pain, if we have a high inflammation rate within our body because of what we are putting into our mouth, understand that all of the symptoms we talked about, the pain, the burning, the electrical shocks, are going to be dramatically worse. And so if pain is your biggest factor, you have got to work on bringing your inflammation down. And out of 100% of your body and your overall health, 70% is what you put into your mouth. And there are people who are unwilling to make those changes. So if you're eating very inflammatory foods, which is the standard American diet, which is sad, so it's high in processed foods and sugars and grains and just crap. It's literally crap, food-like substances. You can expect your pain levels to get worse. You can expect your chronic conditions like heart disease and anything that you take a medication for that chronically, you can expect all of those to get worse. So please do not expect your neuropathy to even think about getting better unless you are willing to put the work and effort in on bringing inflammation down. Same thing with diabetes. Diabetes and all of these chronic inflammatory conditions, because that's what diabetes is, it's like pouring gasoline onto a fire and trying to use a garden hose to put it out. If you do not change what is destroying the nerves, if you know it, for me, it was a surgery. My body woke up, didn't like something during surgery, and then it literally, mine is called Parsonage-Turner syndrome. It's rare, but my body didn't like something during surgery and destroyed the majority of the nerves. So I knew that the destruction was done, but if I didn't control my inflammation with my food, my pain levels were off the charts. Whenever I ate crap, my pain levels would go up. So I knew right then and there that was such a correlation. You have to figure out for you, if you do not squelch this inflammation and you are consistently inflamed, you cannot expect any of your symptoms to be better. You just can't. Now, when it comes to healing and repairing nerves, I understand that is not just take this pill, take this supplement, just change that. We have to look at you as a whole person. And if we don't look at you as a whole person, then we could be missing pieces and parts. And so that's the reason our 4-step process, if you haven't been to one of our webinars, I encourage you to go. If you haven't looked at any of these other Empower Hours, I encourage you to search that in the Search This Group button, because I give lots of information about food as medicine and nutrition. I also give one on microcirculation and circulation and why that's important in healing and repairing nerves. And then the third part of our process that I've used for myself is there equipment out there that would be beneficial for you to physically heal and repair nerves or to improve circulation? And then there's professional support. So if you have not been to one of our webinars, I encourage you to check it. But all you have to do is search this group. You can start by improving your nutrition right now. You can start by improving your microcirculation right now by just watching a couple of these other free ones. So when you're in this group, use it to get action steps out of it, not just to complain and find other people who are in your condition and just sit there. You gotta do something if you expect different results. So I'm going to wrap it back up because I know that there's some new people that just joined us, and thank you so much for joining us this morning. But we are talking about why only pain and burning, and why do I only have balance issues but I don't have any of the other stuff, and why do I have all of that? So wrapping it up is we covered nerve fiber anatomy, and we have different types of nerve fibers. They do different things and they have different symptoms. So go back and take a look at the rest of this video so you can understand what's going on in your body and then what you can do and what steps you can take by educating yourselves and action steps to start turning this around. So thank you so much. I am now about to go in to watch my daughter play volleyball and my husband coach her. So thank you for so much this morning for joining us. Keep posting good stuff in this group and have a great rest of your day.